we're going to do both the study completion form and the protocol deviation form in this one video because they're pretty short. It should save you a little bit of time. Study completion, we're going to enter the date that the patient completed, and some of the checks we're going to be looking at are to see if that completion date makes sense. So in this case, we're saying the patient completed in January, and we're then going to say, did the patient terminate early? And we'll say no. Well, I'm going to tell you that I actually set it up so this patient did terminate early, and part of what you're going to be finding as you do your data review and your QC is that this information does not match up, and the patient should have some early termination information in here. If we had said the patient terminated early, it would give us a drop-down menu, and that menu would give us a series of choices for whether the patient terminated because they died, they had a poor response to the study drug, they were lost to follow-up, that happens a lot, they just stopped coming in and they won't return your calls, they moved, so they couldn't continue with the study, or they were non-compliant with the dose. In this case, I want to leave an inconsistency in here, and I'm going to say that the patient terminated early. And we will be done with this document. So we're going to do save and go to next form and talk about a protocol deviation. You might have noticed as you were entering your patient that they missed more than 2 doses. And that is a protocol deviation, and in fact they should have been taken off of the study. So we are going to say yes, there were some protocol deviations, and again we have this unique patient or protocol deviation identifier like we had for the CONMED and adverse event form. This is the first deviation the patient had. We're asked to describe that deviation, and what the site wrote on the CRF is missed 3 doses. We want to know when they missed those doses, so we have an idea of when they had this deviation. So we collect that information. We know it happened September 1st, 2014, and that deviation of missing the doses continued until the 3rd of September, so that helps us know what visit to go back and to look at. And essentially we have completed the entry for this deviation. We're going to save this record, and we've now got a whole patient in. Congratulations.